Assalamu alaikum, the clinical session. Your role is senior house officer in the neurology clinic. The scenario, Mrs. Anna Idris, 30 years, referred to you with complaint of facial asymmetry. Vitals, blood pressure 130/80, pulse 55, saturation 92 on room air. Please take history, examine your patient, and address her concerns.
Hello, good evening.
And good evening.
Can I confirm your name and your age, please? My name is Ahmed, one of the neurology SHOs here.
Oh, okay, doctor. I am Anna. I am 30 years.
Nice to meet you today.
Thank you.
It came to my knowledge that you are here because of pace asymmetry. We will
Yeah,
have a
doctor.
chat about it. But let me ask you, do you have any breathing difficulty?
And actually, doctor, from time to time, I feel some difficulty. Yes.
I mean now, do you have any difficulty? Can I put you on oxygen a bit?
No, I'm fine, doctor.
Okay. So we are talking about phase asymmetry.
Mhm.
Could you explain it more to me?
Yeah. In the morning, doctor, I wake up. I found my face very scary, doctor. I don't know what happened. Half of my face is dropping.
Okay. Is it only today?
Yeah, last night, doctor, I wake up like this.
Okay, so we wake up in the morning like this.
Mhm.
Is it okay? So you are not sure about when did it start exactly?
Yes, exactly.
Uh, is it worsening since morning?
It's the same, doctor.
Okay. Is it the first time you have this attack?
Yes.
Okay. Do you have headache?
From time to time, doctor, yes, I have headache.
Okay. Can you just do you have headache now?
No, I'm fine, doctor.
Okay. Do you have any muscle weakness?
I always feel weak fatigue, doctor.
Do you mean fatigue everywhere, weakness
Yes.
everywhere in your body? I I,
Yes.
I mean, do you have any lower limb, your legs, you feel like
No.
weak? Okay. Do you have any sensation problems?
No, doctor.
How is your vision?
My vision is okay, doctor. Apart
Okay.
from time to time, I had some redness in my eyes. But
Okay.
my vision were okay.
So you have attacks of red eye,
Yes.
but your vision is fine.
Yes.
When did the last one?
1 month back, doctor.
Is any other symptoms with your red eye?
I'm not sure, doctor, but it was red eye, then resolve spontaneously.
Okay. Do you have any hearing problems?
No, doctor.
Do you have any problems in walking,
No.
in speech,
No.
in balance?
I'm fine, doctor.
Okay. Do you have any fainting episodes before?
No.
Any loss of consciousness?
No, doctor.
Any abnormal movement, shaking hands?
Yes, doctor. I had attack of seizures before, doctor, and I'm taking medication for it.
Okay. You have only attack or you are diagnosed as epilepsy?
They didn't tell me it's epilepsy. They told me I have some change of the electricity in my brain, and they put me on medication for it. It's
What?
called,
Yeah.
yeah, Dibakine.
Okay.
Hello? Yes.
Okay. Do you have any recent change in the dose?
No.
Okay. Do you have any shortness of breath?
Right now, no, doctor, but I always feel short of breath whenever I do exercise.
Okay. Do you have any awareness of heartbeats?
Yeah, doctor, you're right. Sometimes I feel my heart beats is very slow.
Okay. Um, when did it start with you?
A long time, doctor, maybe 1 month, 1 year now. It's like this.
Okay. Do you have any cough?
Yes, I have cough.
Is it dry cough or with phlegm?
Yes. No, always dry.
Is there anything make it worse?
Um, Yes, I feel also with the difficult of breathing while walking or doing exercise. I feel this cough worse.
With exertion, do you mean?
Yes,
Okay. Do you have any fever?
on and off.
Okay. Is this with cough and short?
No, it's not related, doctor. I feel it's not related.
Okay. Do you have any weight changes?
Yeah, doctor, I feel myself not gaining weight. Even my appetite is not good.
Have you lost weight?
I can't say I cannot say that I lost weight, but I'm not gaining weight, and I feel
Are you intentionally
no
trying
at
to-
all, doctor. I feel fatigue. I feel weak. I cannot eat well. I don't know what's ongoing, doctor, with me.
Okay. Do you have any nasal preference?
No,
Do you have any swelling in your body?
no,
Any neck swelling?
no.
Any joint problems?
Yeah, doctor, I feel also joint pain here and there. No specific joint.
Okay. Do you have any eye problems? You mentioned red eyes in attacks. Is it right?
Yeah. Yeah, doctor, that's it.
Do you have any skin changes?
Yeah, doctor. I saw some rash in my legs. It was red one. Then I went to my skin doctor. He gave me some medication. Then it was resolved.
Okay. Um, Thank you. Do you have any change in your waterworks?
No, doctor.
Do you have any bowel changes like loose motion, hard motion?
Yes, I feel some of hard stool, doctor.
Okay, for how long you have this problem?
For almost same duration, maybe more than 6 months now.
Okay. Do you have any tummy pain?
Only when I have hard stool, doctor, I feel tummy pain.
Where is exactly your tummy
All,
pain?
all over, no specific or particular area.
Any feeling sickness or throwing up?
No,
Okay. Do you have any muscle weakness?
uh, it's not weakness. It's like fatigue, doctor. I feel like unable to move, unable to do any activity.
Is there anyone told you that are paler than usual?
No, doctor.
Okay. Do you have any past medical history should I am aware of?
Only the seizure I told you about.
Only seizures. And you are in Dibakine.
Libakin, yes.
And what is the dose?
It's 500 BID.
BD. And there's no recent change of any medicine.
No, doctor, at all.
Are you using steroids for any reason?
No. Why
Okay.
should I, doctor?
Sorry?
Why should I use it? Any
No, no,
any
just
reason?
I'm asking if you are taking for any
Okay, no,
medication.
doctor. No.
Okay. Do you have any previous surgeries?
No.
Drug list, only Dibakine.
Libakin and some painkiller, paracetamol for my headache and for the fatigue and the body ache
Okay.
and
Do you
the
have
joint
any?
pain. I told
Oh,
you.
okay, yeah. Do you have any recent travel?
No, doctor.
Um, do you have any mouth sores?
No.
I will ask you a private question. Have you
Uh-huh.
noticed any sores in your private areas?
No.
Okay. Do you have any allergies
No.
or any family history for any Lyme disease, inherited disease?
My father was a smoker and he had lung cancer.
Okay, sorry to hear this. Are you pregnant?
No.
How is your period? Is
It's fine, doctor. No change.
okay. Are you using oral contraceptive pills?
No, doctor. I am not.
Okay. Any previous miscarriages?
No.
Have you noticed any change in your mood?
Yeah, doctor, you're right. My mood is not okay.
Since when?
A couple of months now.
Okay. Have you visited any doctor for this low mood?
And no, doctor, I didn't. That's why I came to you today. I feel unwell.
Okay. Do you smoke?
No,
Do you drink alcohol?
socially only at the weekend.
Okay. Do you drive?
Yes, my own car.
I came today by driving.
Yes.
Okay, let us discuss driving later because this facial asymmetry may be warning sign of something more. So
Okay.
I will advise you to stop at the moment.
Okay,
Uh,
doctor.
What's your job?
I am gym trainer.
Okay, and how it affect you?
Yeah, doctor, almost I am not going because of this fatigue and weakness. And now my face is not okay.
Okay, I'm sorry. We'll try to help you as much as
Okay,
possible.
doctor.
Are you married?
Yeah, I have my partner.
Okay, do you have kids?
No, not yet, doctor.
Have you tried to have kids?
Yeah, but we just married.
Okay, you don't try it.
We tried, but we just married last month.
Okay.
عم نمشي بالنص.
Um,
Okay.
any problem in intimate relationship?
No, doctor, we are fine.
Um, can I ask you if you have any recent admission or surgeries?
No,
Um, are you using any party drugs?
no, never,
حاجة ما ضربه.
never, doctor.
Okay. Um, have you noticed any gravels in your urine?
No, no,
Okay. Um, do you have any back pain?
no.
Okay. Can I examine you?
Yeah, sure. Quickly, doctor.
So I will examine starting by hand. Check
Yes.
pulse and the
Pulse is 55.
okay. Blood pressure, sitting and standing.
No change, normal.
Okay, we'll go to the neck. We'll examine GVB and the proximal myopathy. Um,
Yes.
uh,
Raise GVP. There is raise GVP. Proximal myopathy. No proximal myopathy, but patient is feeling weak. That's it.
okay. Then I will look at her face. Any buffiness?
Yes. No buffiness, but you see dropping of the right side of her eye, of her vision, of her face.
Okay. Which part of the face is the mouse deficient to which side?
Deviated to the right.
Okay. And all the face affected or
Yes. All the face.
okay.
Or
Uh,
sorry, you can say it's the half of the face. So spare the upper part.
okay, so okay. Thank you.
Yeah, okay.
Uh,
Spare the eye on
it's
and
sparing, yeah, it's
yeah.
sparing.
Okay, yes.
Okay.
2 minutes left.
Then do you have any concerns?
Yeah, doctor, is it cancer, doctor, like my father?
Um, thank you for asking me, but based on the examination and the history taking, I don't think you have cancer.
So, doctor, what I have, is it something serious?
Uh, it could be serious, but based on examination, I am suspecting multiple sclerosis. However, it could be any other rheumatological diseases. We should run some investigation. Um how does it sound to you?
Yeah, doctor. What is multiple sclerosis that you are saying about? I don't know, doctor.
So this is an autoimmune disease. Your defense system is is attacking your body parts. So it's attacking the nervous system and causing a lot of problems anywhere in your body. This is only suspicion. We will run some investigations, some imaging, some procedures. Then we will discuss the diagnosis once confirmed. How does it sound to you?
Okay, doctor. So, will you admit me?
I would admit you. Yeah.
Okay, doctor.
Uh, Before starting, I have no diagnosis. I have
Okay.
a lot of unlinked positive findings.
Yes, yes. It's difficult. Okay, 3 second, 2 second. Okay, now time is up before starting of presentation. I give you, I will give you 10 seconds. Just try to collect and to link all this finding. What might can be. Okay, 10 seconds. Try to collect your thoughts. Okay.
So the positive finding is she came
Yes.
with facial asymmetry. She has
Yeah.
upper motor neuron um,
Yes.
without any affection in the lower limbs or upper limbs.
Excellent.
So and she has seizures which could be related.
Yes.
Uh,
Perfect.
Calcium, I suspect it's constipation, tummy pain. It could be.
Okay.
She has erythema nodosum, which is recovered.
Perfect.
Um Could be sarcoidosis.
Excellent. Perfect, Dr.
However,
Ahmed.
it's not easy
Yeah.
because sarcoidosis can cause upper motor neuron facial.
Yes, and the nuclei. What's called this condition? How you diagnose it?
Erythema nodosum,
No, no.
calcium,
Yeah, you said sarcoidosis, and how the sarcoidosis can affect all this brain finding. What's called?
the syndrome, you mean?
It's not syndrome. It's presentation of sarcoidosis. So what can I call it? Okay,
I don't know.
neuropsychosis. Yes, neurosarcoidosis. You have
Mm.
seizure. You have facial palsy. So what's called neurosarcoidosis, right?
Yeah.
Okay, what's other differential for facial palsy?
Uh, Facial palsy, if upper motors is will be either stroke,
Excellent.
if acute onset stroke or versus
Mhm.
TIA depends on the
Yes,
duration of the symptoms.
the onset. Okay.
It could be space occupying lesion if it's gradual since weeks
So
to months.
that's enough. Yes, that's enough. How you investigate this patient?
First of all, the patient came with facial symmetry. So the first thing I will do after full examination, I will do basic things like full blood count,
Excellent.
coagulation, lipid profile, kidney function, renal function, ESR, and CRP for possible vasculitis. Then I will do CT head,
Okay.
rule out acute intracranial hemorrhage.
Excellent.
Um, I think this is the initial thing. I will admit her because she's not yet. I couldn't tell she's stroke or TIA. She came after a few hours of the facial asymmetry, so I will assume it's more dangerous. So I will assume she has stroke because it's less than 24 hours. It will be TIA. More than 24 hours will be stroke.
Yeah.
She has few hours of facial asymmetry, so I cannot send her home.
Okay. What other indication of admission?
Um,
Mm,
Actually,
yeah, it's one of the indication starting medication, by the way, right?
Steroid. If we'll admit her for steroids,
Yes, perfect. Yes, for steroid administration. Yes, because she came with neurosarcoidosis, and this is one of the indication, strong indication for steroid and
for
sarcoidosis.
steroids. Mm.
Okay. Uh,
You said
how? Yes,
calcium level. I will add calcium level,
perfect. Yes,
A level, and I will do ECG for short QT.
excellent. What do you think here? The bradycardia in this patient, is it only hypercalcemia related?
Is the hypercalcemia can cause bradycardia? I don't think so.
You said long QT for
Short
the long
QT. Short QT. So
short. Uh,
hypercalcemia can cause short QT.
okay, yes, hypercalcemia short QT. So you said that's why I ask you for the ECG. What other finding you or what other causes of bradycardia in this patient? AV
Mm.
block, right? Due to also sarcoidosis. Okay, how you gonna investigate? We sorry, we said the investigation. How you gonna manage this patient?
Actually, it's still biopsy. Sarcoidosis by biopsy, I think, like TB granuloma.
Excellent. Non-caseating granule.
Yeah, yeah.
Not T. Yeah,
I
yeah.
mean, the diagnostic test is biopsy.
Okay, so will you do MRI?
I have to do.
Yes. You might have also granuloma in the brain, right? Or spinal cord. This is one of the presentation of sarcoidosis or neurosarcoidosis. Okay, will you do LP?
Mm-mm-mm. Actually, there's no obvious reason for LB. Why
But
LB?
yeah, it can lead to what's called aseptic meningitis, right? So you might do LP.
Mm.
And you might find lymphocytosis in the LP, pleocytosis with the predominance lymphocytes. So you could do also LP. Okay.
This case
What
is very
about?
difficult. Very difficult, Dr. Bass.
Yeah, I know, but it's okay. The last question. Any other test you can do? Neurophysiological study you want to do?
Nerve conduction?
Yes, exactly. Okay, nerve conduction study. The management plan,
Yes.
pharmacological. Give me the pharmacological because the time already is up.
You said steroids.
Yes, exactly. Yes,
But
exactly.
yeah, yeah, before admission, and just warn the patient about the side effect of steroids
Excellent.
and the medic alert bracelet, steroid card with the dose. Uh, that's all.
Yes. Okay. HRCT, don't forget it for the pulmonary involvement. Okay. Because she has also short of breath and cough. And of course, you will mention the multidisciplinary team approach. It's a
Yeah.
multi-organ affection disease. Yes. Well done, Dr. Ahmed. It's very difficult, I know, but at least you link together.
Mm.
Erythema nodosum, I think it was the clue for your case, along
Mm.
with the short of breath and hypercalcemia signs and symptoms. Really, you did amazing, but the examination, you started examination late. I wished you could start earlier. I can't say you ask unnecessary question because you ask about everything possible and impossible about or related to the scenario. So it's good to ask all this question. And I think you collected and you gathered all this together to find the diagnosis, which is neurosarcoidosis. But you have to know about neurosarcoidosis. Okay? You said sarcoidosis, but why this patient is having seizure? Why her mood is low? Why she has now facial asymmetry? So neurosarcoidosis might present with these things, dementia even, because of granuloma in the brain. Okay?
Okay.
Skin lesion, as you said, erythema nodosum, also lupus pernio, one of the possible. Sometimes lymphadenopathy. You have to examine lymph node as well. The cardiac examination or the heart examination, if you have time, you have to do for the restrictive cardiomyopathy. The chest examination, of course, you have to do because you said in the initially there is low saturation, so you might have finding of interstitial lung disease.
شيلي من الوطن.
Okay, in the form of inspiratory crackers. Will it increase clear with cough or no?
No المفروض.
Yes, yes, exactly. Is it apical or basal? Apical. Okay.
هو sarcoidosis as a topic is not on my head.
You
Okay.
have, yeah,
Okay.
you
Good,
have
good,
to
good to
face
know.
the truth.
Yeah.
Yeah. In the exam, you will not say I didn't expect.
Yeah,
No,
yeah.
you have to expect everything, every topic. Okay.
Okay,
And now
fine.
the case, whenever you do it in the practice, you will memorize it from A to Z.
Yeah.
Yeah. In one occasion, you have to read the topic after finish this topic, this session. It
Yeah.
will be, yeah, good practice if you do that. I guess the stages of also sarcoidosis lung, I mean sarcoidosis or pulmonary, is very important to know about. From 0 to 4. So they are 5 stage. 0 is nothing. Okay. 1, you have granuloma in the lymph node. 2, you have granuloma in the lymph node and lung. 3, you will have fibrosis with granuloma. And 4, you will have only fibrosis. And the indication for steroid in pulmonary, which stage? 3 and 4. The last stage, okay? 3 and 4. Indication for steroid. Steroid also indication neurosarcoidosis. The eye also one of the indication add in this scenario.
Okay.
Yeah, the redness in the eye, as mentioned, uveitis, it's one of the association with sarcoidosis.
Okay.
Okay, you have any question?
No, thank you. Good case.
Yeah. Let's read the comment. Okay, Doctor 123, I don't know the name. Yes, neurosarcoidosis. GBS. I guess GBS will not be presented unless the patient already manifested with lower limb weakness. High calcium, yes, it was due to vitamin D activation. So it will be with hypercalcemia signs and symptoms. Hypercalcemia, by the way, one of the indication of steroid. Ask him about prognosis. So who's Dr. Q? Okay. What do you think the prognosis for sarcoidosis? Is it treatable or controllable condition? Hello? Okay, Dr. Ahmed. What do you think about the prognosis in neurosarcoidosis?
I assume it's not treatable. It's not
Yeah,
curable. Yeah.
it's not curable. So you can control with medication, either
Yeah.
steroid or steroid sparing agents.
Mm.
But I remember one of the good prognostic condition, it's called Wolfram syndrome, right? Fever with lymphadenopathy. This is carry good prognosis in sarcoidosis. About neurosarcoidosis itself as a prognosis, I'm not sure about it. But anyway, sarcoidosis is one of the controllable, but it's not curable. So whatever the patient will have recurrence and flare up. Treatable with the steroid, yes, exactly. Controllable exactly, but not curable. Yeah, the scenario, please. Okay, it was. I will send the scenario again. Dr. Ahmed, please write your scenario. Let's start the next scenario. Anyone has question? Why neurosarcoidosis or what? NCS, I don't know what's NCS. Neurosarcoidosis? Nerve nerve conduction, you mean nerve conduction study? Okay. Yeah, it will show you the finding in the nerve. This is facial nerve affection, right? So you can diagnose it by that. Any facial affection for any disease, you can say neurophysiological study. just to know the velocity and amplitude and so on, demyelinating or axonal. I'm not sure what the mechanism of sarcoidosis in the nerve, but it's granuloma in the gland, sorry, in the nuclei. So I think it will not be conclusive for the nerve itself. It's something in the nuclei. Anyway, you will do MRI, and the MRI will be diagnostic for granulomas. The same granuloma in the lungs, it will be in the brain. The biopsy also will be diagnostic. You have to do biopsy either from lymph node or from the lung itself. Okay, Georgina, second scenario, Georgina, 30 years old lady who is present day with vision problem.
It's very, very easy scenario, not like you.
I asked that challenging case. Why you didn't bring difficult?
I done with someone else, so
Okay, no
I
problem.
you know.
No
Uh,
problem.
so timer would be with me or just
No, no, I will share it. Just remind me when 2 minutes left.
okay.
Okay, you will see the screen. Whenever you see 2 minutes left, just remind me. I
Okay.
will not look at the screen. Okay, Dr. Ihda, shared corticosteroid are the first line therapy with other immunosuppressive agents such as infliximab, TNF, alpha inhibitor, being used subsequently. Yes. So steroid and steroid sparing agent simply. I don't think they will ask in details in the management because this disease is multi-system affecting. So I guess the discussion with the examiner will be around the case, the presentation, the manifestation, the complication, the association, and and the differential diagnosis as well. For the management, multidisciplinary team on the top because he had a lot of finding the cardiac, the neuro, the pulmonary. Okay, but for the details of what immunosuppressant, I'm not sure they can do it. Anyway, we can share it in the group, Dr. Ihda. If you have specific medication as a steroid sparing agent, please share it, like TNF and other immunosuppressant. Okay, Dr. Ahmed Ali said it's facial palsy, lower motor or upper motor, the granuloma in the brain, so it will be upper motor neural lesion. It's not in the facial nerve itself. By the way, there is also some affection in the lower spinal cord level. The patient might present with weakness, I mean unilateral weakness, again due to granuloma in the spinal cord. And the diagnostic features will be by MRI and even sometimes LP. So neurosarcoidosis, one of the granulomatous disease in the nerve tissue, either the CNS, I mean the brain, or the spinal cord. So it's not the nerve itself, it's in the brain tissue. Dr. Ahmed, are you ready?
Yes, I'm ready.
Thank you, Dr. Ahmed. Ahmed Ali. Let's start again. The name, sorry, Georgina, 30 years. Vision problem. Okay. Okay. Hello, I'm Dr. Mukhtar, the doctor in the clinic today. You must be Mrs. Georgina.
Yes.
You are 30 years old.
Yes.
We are here to discuss about your health issue. That okay for you?
Yeah. Sure.
Okay. Can you tell me more about your complaint?
So it's a couple of weeks. I have blaring of vision. There's no improvement. I use some topical eye drops, but it doesn't improve at all.
I'm so sorry to hear about that. Can you tell me more about this blaring? What do you mean by blaring vision? Did you see
Yeah,
bubble?
no, I couldn't see the thing clear. So
Okay.
this is just hazy.
Okay. And when you close one eye, the other will be clear, or both eyes are,
No, both eyes the same.
but you don't see double.
No.
Okay. Can you tell me exactly which area of the vision field you can say about the blur? I mean, is it the peripheral one or in the middle or
No.
in
All the field, I feel it's a blurry. I have a blurring of vision.
all the field?
Mm.
Okay, any color change? I mean, the color vision is it change?
No,
Any change of the during night?
no,
Any specific or particular time for this vision problem?
no,
Okay. Apart, is it the first time ever, or you have?
no. I have a lot of attacks before.
Okay. Can you tell me more about it? When is exactly started?
So started maybe 5 years ago. It
Okay. Are you?
happened. It happened
Yeah.
to me 6 times.
Okay. And did you notice this happen with the hot weather or hot shower?
No,
You have any particular time you notice this happen with it?
no,
Okay. Did you notice anything related to this problem when it comes?
no. Just I feel my eyes red.
So you notice some redness in your white area,
Mm.
both eyes.
Both eyes.
Any dryness,
No,
any dropping of the lids.
no,
Okay. Are you diagnosed with any condition I should be aware of?
no. Just I have 5 years ago. I got DVT in my legs, and I'm using rivaroxaban.
Okay. And any diagnosis about the cause of this
No,
clot?
no one told me anything.
Okay. What side? This DVT?
Left side.
Left side. Okay. And still you are taking this blood thinner?
Uh, yes, because the doctor said I may have another clot.
Yeah. Okay. Uh, okay. Apart from this, can you tell me if you have any headache?
No,
Okay. Any hearing affection?
no,
Any unsteadiness?
no.
And any redness now in your eyes?
Yes,
In both eyes?
yes,
Okay. You feel any pain in your eye?
yes.
Both eyes?
Both eyes.
At the back of your eyes?
I just pain in my eyes. All my eyes hurting.
All your eyes. Okay. You have any infection recently in your mouth, in your ear, in your nose?
No,
Nothing. Okay. Apart from this, you have any high body temperature?
no,
Any loss of weight?
no,
Any loss of appetite?
no,
Any lumps or bumps in your body?
no,
Any night sweats?
no,
Okay. Any weakness in your body?
no,
Any lumps? Any numbs or feeling tingling?
no.
Any difficult swallowing?
Yes,
Okay. And when exactly started?
it started 3 months ago.
And did you notice related to certain type of food?
No,
Is it to water or to the food?
everything.
Everything. And how you are compensating for that?
I try to drink.
To drink. And with drinking, is it okay?
It's better. It's better
Better.
than solid, but yeah, it's still painful.
Okay. Any mouth sores?
Yes, I have.
And how frequency you have it?
I got it for the last year, maybe 4 times.
Okay. And any sores, any other area in your body? I mean, sorry for this question, in your private area,
This time, no.
but you had it before?
Once,
Once. Okay. And are you taking anything or any medication for that?
no. Just rivaroxaban for DVT.
Okay. Any skin tightness?
No,
Okay. And any change of your bowel habit?
no,
Any tummy pain?
no,
Any short of breath?
no,
Any history of cough?
no,
Any chest pain?
No.
Awareness of your heartbeat.
No.
Okay, and any change of your water work.
No.
Okay, I will ask you some sensitive question.
Yes.
What about your periods?
Regular.
Okay, any miscarriage before?
No.
You have kids
I have two.
and they are fine.
Yes.
Okay, and you are taking any other medication apart from the blood thinner?
No.
Okay, any family history of blood clot?
Family history. My mom has systemic lupus and antiphospholipid syndrome.
Okay, and any history of clot or stroke in your family?
My dad has a stroke 10 years
In,
ago.
okay, any blood disease in the family?
No.
Okay, any travel recently?
No.
Sorry for this question. Do you use any recreational drugs?
Never.
And do you have a partner, right?
Yes.
Any casual relationships?
Never.
Okay. Any weather preferences or intolerance to any weather?
No.
Do you smoke?
Yes.
How many for how long?
20 cigarettes per day
20 cigarettes. And for how long?
for the last 20 years.
Yeah, it's so harmful for your condition and in all general health. So strongly advise you to stop smoking. Is that okay?
Thank you. I'll try.
Okay. Do you drink alcohol?
No.
What's your job?
I'm a teacher.
And how the impact of this on your job?
It's affecting me a lot, doctor.
Okay. I will try to help you in this regards.
Thank you.
May I examine you now?
Yes.
Okay, I will start by the general look. Any characteristic features?
No, just red eye.
Red eye. And the vitals?
Blood pressure is 125/80. Pulse is 75. Regular.
Okay. Any skin rash you told me about?
I have rash in my legs. Yeah.
Okay. With sores?
No, it's like a red tender.
Tender. Is it present now?
No, it's
And
resolved. It was 2 days ago and resolved.
okay, was it oozing?
No,
Tender with no ooze. Okay. Any joint problem?
no,
And how this rash disappeared? Did you use any medication?
just topical cream.
Topical cream was the name?
I couldn't remember, doctor.
You have any surgery before?
No,
Any allergy to any medication?
no,
Okay, I will examine now the joint. Any stiffness in the joint in the hand?
no,
Any skin tightness?
no,
Any skin rash in the hand?
no,
And the face, I will examine for any rash in the face, smaller rash.
no,
The eye itself, both eyes are red.
yes,
So I will examine for the acuity first,
yes,
one by one. Is it preserved?
preserved,
Okay, and both eyes. Then I will examine now the field.
preserved,
Intact. Okay.
intact,
The reflexes, pupil,
normal.
normal. Any discharge from the eyes?
No,
Okay, I will ask now its shape, movement in all direction.
no ophthalmoplegia.
No ophthalmoplegia. I will offer for fundoscopy.
No need.
No need. Now I will examine the mouth for any ulcers.
Find two ulcers.
Two ulcers. Okay. Is it painful?
Yes, doctor.
Painful.
Yes.
Okay. In the mouth, the back of the tongue, any white rash?
No,
Okay. Are you diagnosed with HIV or someone told you you have HIV?
no,
Okay. Do you have tattooing or history of tattooing or piercing?
no,
Okay. Now I will examine for lymph node in the face, cervical and auricular. Any lymphadenopathy?
normal.
Normal. The vitals you told me is normal, right? Blood
Yes,
pressure,
yes,
pulse,
yeah,
and temperature.
yeah.
Okay.
Normal.
I will examine now the mouth, at the back of the mouth, I mean, for any sores,
Yeah,
uh, for the difficulty swallowing, I mean.
normal,
Any,
nothing. Only two
nothing.
ulcers.
Okay, any thyroid swelling?
No,
No. I will examine now the chest, any ulcers or rash in the chest?
this is normal.
Normal.
Mm.
Okay, quick examination at the back of the lung to examine for any infiltration,
No,
crackles, no crackles.
no.
Abdomen,
Soft lax,
soft
non-tender.
lax. Okay. Lymphadenopathy in the inguinal, I will offer it also.
No need.
I will offer for genital examination.
No need.
No need. Okay, the legs, the left is specific for circumference. Any swelling?
No,
The other legs also, other leg, any swelling?
no,
Any thrombophlebitis signs?
no,
Any leg edema?
no.
Okay, still I have time.
Yes, remaining, I think, 3 minutes.
Okay, I will examine now the heart quickly for any murmur.
Yeah, no murmur.
No murmur. Apex beat in place.
In place, apex.
Okay. I can do pronator drift quickly in one arm and both arms, sorry. Any
Okay,
any
normal.
affliction? May I know what are the concern?
Um, do I have a problem? Do I have multiple sclerosis?
I appreciate your concern, Mrs. Madam. What I suspect now is something different than multiple sclerosis. However, multiple sclerosis is still one of our possibilities since you have family history of the same condition. I mean, the multiple sclerosis. We have to run some blood tests and some scans, some imaging to confirm the possible diagnosis for your condition. You have
Mm.
any other concern?
Do I need to be admitted to the hospital?
Uh, for meanwhile, yes, we have to admit you
Why,
uh,
doctor?
because the vision is something dangerous if you didn't treat or take medication for your problem. However, we will try to be fast in the diagnosis. Is that okay
Okay,
for you?
okay, doctor. I
May
think
I ask you one more question? Do you have any skin itchiness?
no,
You feel any skin irritation while taking hot bath
no.
at all? Okay. Any other concern?
Thank you, doctor. Thank you.
Okay. Still we have minutes.
I think you
Okay.
have 40 seconds or
40
just.
seconds. Okay. And I want to the lid, any lid swelling around the eyes,
No,
examination,
just red eye with blurred vision.
red eye with blurred vision. Okay, and no headache, right?
No headache.
Okay. Any other concern, Mrs. Georgina?
Thank you, doctor. I'm waiting for the diagnosis. What you told
Yes.
me.
Okay. Are you driving?
Yes.
Okay. So Timber, will advise you to stop driving. It's
Time,
for your safety.
time,
Okay.
time, time.
Okay. Uh,
What's your diagnosis and potential diagnosis?
yes. I examined Mrs. Georgina.
Yes.
She's young, and I took history from her. She had vision loss, or sorry, blurred vision. It's on and off, frequently coming, and in both eyes. There is also history of blood clots. I mean DVT, and also she had history of ulcers, mouth ulcers, and genital ulcers. She denies any history of miscarriage. She has family history of multiple sclerosis as well as stroke and no family history of thrombophilia. On examination, I found redness in her eyes, both eyes. However, the vision, acuity, field, reflexes, all are preserved. No diplopia as well.
So what is the diagnosis?
Yeah, so my diagnosis, this patient might have Behçet disease based on the history and the examination finding. Uh,
So why she has red eye?
yeah, it's association also with Behçet to have uveitis
Okay.
and anterior uveitis. So I have to do some investigation to confirm our diagnosis and to rule out other possibilities.
What is test you'll do?
Yeah, test is called. Be- excuse me, wait. Buffering test.
Would you like to do FPC, full blood count?
Yes, I will
Basic?
do
Yeah.
full blood count, of course, to rule out anemia of chronic disease, also inflammatory markers, CRP, ESR, procalcitonin. It might be high as inflammatory disease. Kidney function, also one of the important to rule out any affection to the kidney.
What is the affection of the kidney with Behçet?
Yeah, it might be amyloidosis.
And what does it cause for the kidney?
Yeah, it might be complicated with the renal vein or renal artery thrombosis.
What is the syndrome of the amyloidosis in kidney?
Amyloidosis in kidney.
What is the cause? What is the syndrome it cause?
I can't understand the cause of.
So no, no.
Yeah,
Amyloidosis if affected the kidney, what kind
yeah,
of symptoms you will have in the kidney?
yeah, proteinuria.
So what does it mean? Nephritic syndrome or
Yeah,
nephrotic?
yeah, 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 nephrotic syndrome.
Okay.
Mainly nephrotic, yes.
Yes. And what else if confirmed amyloid? Is there any blood test to do?
Yes, amyloid protein and protein electrophoresis in the serum and in the urine.
Okay. Is amyloidosis can affect any other part of your body?
Yes, can affect the lungs, sorry, the heart, restrictive cardiomyopathy, and the brain, restrictive, sorry, infiltrative lesion in the brain,
Mhm.
and the liver as well can cause infiltrative condition, the hepatitis and chronic liver disease. Nerve affection, it
Yeah.
might be also there. Yeah.
So what is the treatment for basic disease?
Yes, in the acute flare-up, I could give this patient steroids in high dose for induction of remission. And for the long term, after calling multidisciplinary team approach, including the neurology and rheumatology, and also gynecology and gastroenterology, social worker, as well as for specialized nurse, counseling the patient about the treatment and the possibility of starting steroid and the side effects of steroid before starting the steroid. Apart from this, since she has history of DVT, patient might kept on anticoagulant lifelong for the recurrent DVT
Okay.
and risk of thrombosis again.
Is there any criteria to diagnose basic disease?
Uh, as a score, no, I'm not sure about a name, but I remember Buthering test, skin test for diagnosis, thrombophlebitis and
I am.
amyloidosis.
I am.
No, I'm not sure about the name of criteria.
Okay. Thank you.
Time is up.
I think it should be 5 minutes, is it right?
Yes, 5 minutes.
Yes.
Okay.
Well done. شفت easy.
No, it's not easy.
It's easy, easy scenario.
Easy peasy.
Not sarcoidosis.
Yeah, yeah. But sarcoidosis is also easy as erythemanodosum.
Maybe
Anyway,
I haven't practiced it before, so it's good for me as a new.
yeah, this is the most important thing to learn from the new more than from the old practice cases. I mean, if you practice case before, so what you will learn if you practice it again and again? For me, also, basic is one of the old new. I didn't practice it long time, but as a vision problem, it's first time for me. Yeah, what I
Okay.
remember in the basic as DVT, PE, but in vision and uveitis, no, it was the first time. And but the clue here, as you said, the genital and mouth ulcer. Okay, please comment first. What I missed, what I did.
Actually, you done well. I believe. Um, so painful in recurrent attack. You rule
Mhm.
out multiple sclerosis. You ask for weakness and neurological symptoms. Um, I don't think you miss anything, but any problem in eyes, I will check the carotid. I will ask if they have any
Yes,
neck pain or any neck trauma.
agree.
It took a couple of weeks, have blurred vision, so it's a chronic thing. It's not suspected any kind of vascular reason.
Yes.
Painful and remission, remitting, relapsing. It could be anterior uveitis or multiple sclerosis or scleritis with rheumatoid arthritis. All of them is painful.
Mm.
So if you have painful loss of vision, think about optic neuritis, multiple sclerosis, anterior uveitis can cause loss of vision, and scleritis, which is common with
Yes.
rheumatoid arthritis. So this
Mm.
scenario could be rheumatoid arthritis if I change it to scleritis.
Yes. Yes.
Basic disease, I think, is the clue for diagnosis is history of DVT and BE.
Mm-hmm.
And the clue Georgina said to you that she may have another blood clot. So she's frankly saying to you, I have post-thrombotic state.
Yes.
With uveitis, I don't think there's any other disease causing uveitis and the post-thrombotic state. Um, there's no miscarriage, so no antiphospholipid in this kind of age. It could be systemic lupus and antiphospholipid. You ask about polycythemia rubra vera, which is
Mm.
excluded by etching with hot pass. Um, what else? OCB, oral contraceptive pills, she's not using. No active malignancy, and she's not pregnant. So actually, for acquired thrombophilic states, there's only basic remaining. Um, I don't think. I think you ask for everything. Um, yeah, erythema nodosum. Yeah, in legs is one of the criteria to diagnose basic.
Yeah.
Um,
What are the criteria you told me about? Is there a specific name?
there is major criteria and the minor criteria. Let me
Oh,
try to find it.
okay.
Um, because
Okay, the skin test.
Bisargi test.
Yeah, Bethesda test. Okay.
Um,
So whenever you put a needle under the skin, the rash will appear.
yes.
This for Bethesda test. Let's put differential in this patient because you didn't ask me about differential. As you said, anterior uveitis as PSET and
But
scleritis,
what
right?
else can cause anterior uveitis?
Ankylosing spondylitis,
Do you mean seronegative?
seronegative arthritis, yes.
What is a seronegative?
Reiter syndrome, reactive arthritis, ankylosing, and gouty arthritis.
No. Psoriatic psoriasis.
Yeah, psoriatic,
So
sorry, yeah, psoriatic, yes.
ankylosing, reactive, no more writer.
Reactive,
It's reactive.
okay,
And enteropathic with inflammatory bowel disease.
yes,
All of them
yes.
seronegative. And sarcoidosis, by the way. So your case was uveitis.
Yes, it was also, yes.
So uveitis and sarcoidosis. So this is the main reason. Behçet, sarcoidosis, seronegative spondyloarthropathy.
Yes,
Yeah.
perfect,
I will
yes.
try to find the criteria for Behçet,
It's
then I will
okay.
share it in
It's
the
okay.
group.
Even not now, you can share it to the WhatsApp group anytime.
Okay. I think I
Yeah,
learned a lot today
yeah,
from
me
all of
too.
you.
Really,
Uh,
yes,
just
amazing cases.
open the comments for people
Yes,
to
thank,
criticize.
thank you, Dr. Ahmed. Thank you. Someone asked about seronegative. Shall we ask? You can, in every patient scenario, you can ask about skin rash and joint pain. You have to ask, not you can, you have to ask. It's one of the systems you have to screen about in the system review. Skin rash, joint pain. It's enough to ask. If you found joint pain, you can add the other question for joint pain, like stiffness, like if you suspect, for example, other seropositive or seronegative, you can ask about other finding like skin tightness, skin rash, as well as the complication of rheumatoid, dermatomyositis or association of dermatomyositis, for example, muscle pain, or muscle tenderness, and so on. So every question will give you a door to ask or to open for the next question. Whenever you have positive, you have to ask about the next. So don't miss, for example, in this patient, if you suspect ankylosing, of course, whenever you will start the ankylosing by questioning about the joint pain and you find back pain, you have to ask about other A's. One of them anterior uveitis, as in this patient. Then you can ask about AV block. You can ask about apical fibrosis, short of breath, and you can auscultate as well. Tendon and Achilles tendonitis, amyloidosis. Whenever you open a topic, you have to screen it. This is the take-home message. As in this scenario, anterior uveitis, you suspect a lot of disease. Once I discovered there is relation to blood clot, I thought about BEHCET, mouth ulcers or mouth sores. Then you have to ask about genital sores. You can ask also about dryness in the eye. You have to screen the disease manifestation all collectively, okay? To confirm and to conclude your diagnosis and to be sure this is the case. So if you ask, for example, mouth ulcer and you skip the genital ulcer, how you be sure that this is BEHCET? You have to ask about everything related to BEHCET. Erythema nodosum one also of the characteristic finding, so you have to ask about skin rash, and you might examine if you have any finding in the skin rash. This is the point, and this is the skills and paces how to correlate and how to explore the things, not only system review and going to the next system without exploring the positive. By the way, in this scenario, Dr. Ahmed also he can also comment on this. Paroxysmal nocturnal hemoglobinuria, one of the thrombophilic conditions. So I can ask also about the long-standing urine might turn to dark, or in the morning, early morning, you notice your water work being dark. This is one of the systems or the disease might associated with history of blood clotting. You will be unlucky if the case like this. I mean, if you skip the system or the paroxysm, the question for paroxysmal nocturnal hemoglobinuria. By the way, if you have paroxysmal nocturnal hemoglobinuria, you will have anemia. So you have to link all things together and how to do screening for others related to the possibly to the condition. Okay, as Dr. Ahmed said, you can suspect seronegative. So you have to ask about joint. Whenever you have joint pain, you suspect seronegative. Okay, go ahead, examine the nail or ask about nail change. Ask for skin rash in the scalp area for psoriatic, ankylosing, any back pain, and any discharge. Sorry for this question coming from your private area for reactive arthritis. You have any history of change of your bowel habit. This is for enteropathy, arthritis. It's like that. It's a skill how to explore a thing whenever you suspect it. Okay. Any other question, please feel free to comment verbally or written.
Dr.
It's not.
Basim,
Yes.
regarding criteria of Behçet disease,
Yes,
okay,
perfect.
recurrent mouth ulcer should be all over 1 year, 3 times at least, okay?
Okay.
That one, first one should be present. And
Okay.
two of other things like recurrent genital ulcer or skin like erythema nodosum or
Okay.
eye like anterior uveitis and positive surgery test.
Excellent. Is it named by any term, this criteria? or just criteria
Yes,
for
it's
basic?
international study group criteria for
Okay.
basic disease.
Okay, perfect, Dr. Ihda. Thank you so much. Thank you for your effort. Please, if you have time to share it in the WhatsApp group,
Okay.
so it will be beneficial for all. Okay, before you end, how to acknowledge someone? What are the phrases to be said to acknowledge someone? Please, could you help me knowing the phrase? What are the phrase? I cannot understand. Can you please explain what you mean by this comment? I cannot understand. Okay, I guess it's meaningless. I don't understand anything from this comment. I don't know if it's related to our meeting. Any comment from others, please? Dr. Ahmed Mohanna, you have any comment to add?
No, but neuropsychosis is difficult.
You learn a topic today called neurosarcoidosis.
Okay.
Okay,
دكتور
and not only neurosarcoidosis, it's sarcoidosis. Okay, yes,
Mhm.
doctor.
لا لا عادي كمل. أنا لما سألت على
Okay,
الكومنت بعدك
doctor.
هتكمل عن النيوروساركويدوسس. كمل عم بسمعك بعد ما تخلص
No,
قول
no,
يعني.
no. I finished, Dr. Hind. Yes, you can speak now.
بس كنت
The
بدي
mic with
أسألك
you.
اليوفيايتس، الكويستشنز اللي سألتها على اليوفيايتس أنا ما
Mm.
انتبهت كيف عرفت إنه هي يوفيايتس، فشو اللي كان بوزيتيف بالهيستوري حتى عرفت إنه يوفيايتس؟
Redness on and off, and the vision also affection on and off. There is pain in the eye, and both eyes
هي
was affected.
الفوتوفوبيا هي اللي بتفرق ما بين السكليرايتس واليوفيايتس، لأنه أنت
Okay.
البين وbeing on and off recurrent الاثنين بيشبهوا بعض، موجودين بالسكليرايتس واليوفيايتس. فمهم كتير لما بتكون الحالة يوفيايتس إنه نسأل على الفيجن افكشن، لأنه
Mhm.
سواء سكليرايتس ولا يوفيايتس الفيجن is intact. تمام، فهذا بيأكد لك لأنه بالبهست في عندك central vein occlusion أو central retinal
Yes,
artery occlusion،
occlusion. Yes.
فلازم يكون في عندك تفريق ما بين الفيجن افكشن ونو فيجن افكشن. فمشان تتأكد إنه هي يوفيايتس ولا serious thrombotic event بالبلد سبلاي تبع الريتنا.
Mhm.
فالفيجن question is very important. being
Yes.
sudden being sudden painful ولا sudden painless. تمام، to exclude مثل ما قلت لك الثرومبوتيك event. بعدين إذا أنت لقيت إنه ما عندك thrombotic event والvision is intact you confirm اليوفيايتس versus the scleritis by asking about photophobia. اليوفيايتس بتعمل لك فوتوفوبيا، السكليرايتس ما بتعمل لك فوتوفوبيا. تمام،
Okay.
فعلى الأقل هيك أنت لازم تتأكد إنك أنت عم تتعامل مع كيس اوف يوفيايتس. تمام، بالذات بالبهست لأنه كمان الثرومبوتيك ايفنت is common. وبيجي بالآي. تمام.
Mhm.
فمن أول يعني مرة جابت دكتورة أنوم case previously I had a vision problem. What was it? I lost completely my vision. طب هلأ لا I have just like disturbance and pain. طب do you have photophobia? Yes. فهذا يعني أحيانا بيستغلوا إنه ممكن الفيجن presentation تجي بأكثر من طريقة، فبيجيب لك previous presentation و current presentation، والاثنين حيدلوك على البهسة ترى، بس if you analyze very well حيساعدوك بدل ما إنه يلخبطوك. تمام،
Mhm.
فهذا
Okay.
بمختص الفيجن. والسؤال الديارية is very important بالبهست. تمام، لأنه بيفرق لك ما بين الكرونز وما بين البهست، والاثنين بيعملوا يوفيايتس والاثنين بيجوا بجوينت بين. تمام،
Yes.
فمهم كتير نسأل عن الدايرية، ومهم كتير كمان نسأل على الجوينت بين إذا deforming ولا non deforming. بما إنه
Yes.
حطيتوا أنتوا differential diagnosis الروماتويد. تمام، شو اللي حيطلعني من دائرة الروماتويد؟ الديفورميتي. إذا
Stiffness or stiffness and
عليك
deformity. Yes.
اللي عليك نور، فأنت you should really يعني take care of these history wise و examination wise،
Yes.
لأن البهست والروماتويد والساركويدوسس والكرونز disease very hot topics، وكلهم كان present by erythema nodosum by eye symptoms by joint pain. تمام، فحتى تقدر تعرف أنت الكومبليكيشن تبع مين بدك تسأل، لازم من
Mhm.
البداية تحط إيدك على الدايجنوستس. تمام،
Mhm.
فنتأكد من الجوينت ديفورمينج ولا لا، نتأكد في دايرية ولا لا، بلادي ولا لا، نتأكد من نوع الآي involvement إذا uveitis scleritis ولا thrombotic event حتى نقدر نكمل. تمام.
Perfect. Yeah.
these things بالhistory are very important. وأحيانا البهست لا ننسى إنه كمان في نيورو بهست، يعني بما أنت عم
Yes.
تحكي عن نيوروساركويدوسس
Yeah.
فالبهست بيجي باسبتك meningitis،
Yeah. Septic
بيجي
uveitis.
ستروك in young. تمام. فهالأشياء هي كتير مهمة. اتفقنا؟ يعني حتى
Yes.
الهيستولوجيكال symptoms مهمة بالبهست مثل ما مهمة بالنيوروساركويدوسس.
Perfect.
فبس هذا اللي حبيت أضيفه.
Perfect, Dr. Hind. Thank you so much. Appreciate it.
الله يسعدك يا رب.
إياك يا رب. آمين. Okay, thank you, Dr. Hind, for your precious comment usually. Any other comment from others, please?
Uh,
Yes, Dr.
I have a comment.
Mhm.
Actually, uveitis and scleritis can cause loss of vision,
Mhm.
if not easy.
Can cause loss of vision is a recurrent مع residual مع residual deficit
I
كل مرة.
mean, if not,
اليوفيتس can end up by loss of vision، لكن
yes,
one attack 2 attacks بالبداية الحمد لله completely reversible بالستيرويد usually. لكن
if
فعلا في
if
بهست
not
patients they
treated,
can
mm,
they can
if not,
lose their vision because of this. أنا معك، لكن بدك تفرق ما بين initial presentation وما بين recurrent presentation و sequelae of poor treatment و poor control. صح بالنهاية ممكن تعمل loss of vision.
okay.
Okay, clear now.
طبعا بس اعتقد كومنت اصل السكليرايت اعتقد والفيايتس البيوبل
Yeah,
برضه تقريبا البيوبل افكشن تقريبا
as a
الفيايتس
reaction, you mean the reaction, right?
بيكون في تقريبا في أيوة بيكون في بيوبل افكشن في اليوفيايتس اما بيكون موجود في السكليرايتس يجي البيوبل از نورمال بس
Yes.
اليوفيايتس تقريبا في افكشن البيوبل تقريبا بيكون اوبس something like that
Yeah, because the uveitis
if
mean
I remember yeah yes
exactly because the uveitis near to the iris.
yes
I mean the area of cornea and the vision, but
yeah
scleritis.
when you're doing by torch you can see the
Yeah.
difference between the pupils
Okay. Thank you, Dr. Ahmed. Thank you.
thank you
Okay. Anyone else want to comment, please? It's nice session, Dr. Ahmed. Thank you for your practice with me and also for your case today, BEHSIT
Thank
or
you. Thank you.
vision affection due to BEHSIT. Please, if no one has comment, we can end the session. Be brave to say anything, please. Comment, question. Feel free to ask. It seems everyone understand everything, so we can end the session today. Thank you, all of you. See you tomorrow with Communication Day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.